thanks. Doctors around the country are seeing hospital beds stretched thin. Data from the Department of Health and Human Services shows 75% of our country's pediatric beds are full. One driving factor behind this, the rise in RSV cases. Positivity rates at a high. The CDC reporting a 19% positivity rate, in fact, at the end of October. Our Bill Folsom looking into this issue here in southern Colorado. He's live for us tonight at Children's Hospital. Bill?
Yeah, there are so many kids getting this so early in the season. They are calling it an unprecedented concern. That's from the medical pros. We also heard from a mom today who said, you do not want your kids to get RSV. A curly-haired kid who just wants to play. His mom, on the other hand, takes a break to offer her perspective on RSV. Her park play date and little boy Landon spent a week in the hospital because of it.
It's unbearable. So he is my first and only child, and watching him struggle to breathe and the retracting in his chest at such a young age without him being able to tell me anything was wrong was very terrifying, especially as a new young parent.
She shares her experience so other parents of young kids are cautious. She warns it can be very contagious. When Landon caught RSV, it was the tail end of COVID and the family was still avoiding public places and crowds.
Which means we did not have much contact with people, and he still contracted it probably from, just walking past somebody outside.
The concerns go beyond the immediate risk while sick. Mom, Catherine, believes some of the health issues she deals with, like asthma, are tied to her own bout with the virus.
So when I was a baby, I almost died from RSV. I was a couple months old. I was hospitalized for multiple weeks.
Landon doesn't remember fighting for his life in the hospital. The memory for his mom is vivid.
Seeing your child hooked up to tubes and struggling to breathe and on oxygen, and having to go through that fight where they take them off oxygen to see if they can breathe and their breathing stops, it's terrifying.
We did hear from the medical director here at Children's today. He says it is crucial that parents take precautions to protect their kids. That includes many of the things you did during COVID: washing hands, sanitizing areas, staying away from crowds if you know somebody is sick. In Colorado Springs, Bill Folsom, News 5.
Bill, thank you. An RSV vaccine for older adults is in the works. It would be the first of its kind. The pharmaceutical company GSK has announced the FDA accepted its application for an RSV vaccine for seniors. The FDA agreed to give the vaccine an expedited review and says it will announce a decision by early May.